Good morning and welcome to Empowering Older Adults, Strengthening Independent Living with Resources and Support. This training is supported by a grant from MetaFund. A bit of housekeeping. Today's program is being recorded. For audio and video, all participants are muted and without video to minimize distraction. For chat, submit your question or comment by selecting the chat button at the bottom of your screen and sending a message to Q&A. Questions will be forwarded to the host and answered time permitting. For closed captions, select the live transcript button at the bottom of your screen and click Enable Live Transcription. And at this time, I would like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you, Trey. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council and our collaborating partners, I want to welcome you to this third in a series of 6 online training sessions entitled Empowering Older Adults. Communities of faith are hubs where older adults feel safe, valued, and may escape social isolation. Faith and lay leaders entrusted with their spiritual care are more often than not first responders in instances when the well-being of older adults is at risk. To better equip faith-affiliated caregivers with the necessary insights, skills, and resources to minister to this vulnerable sector, the San Francisco Interfaith Council, in collaboration with the San Francisco Department of Disabilities and Aging Services and the Institute on Aging, supported by a grant from the MetaFund, offers this 6-week online training series entitled Empowering Older Adults. This week's training session, entitled Injury Prevention, will be led by Rita-Huiting Huang, health worker for the Community and Home Injury Prevention Program of the San Francisco Department of Public Health. The focus of this presentation will be fourfold. First, to identify fall and injury risk hazards in the home. Second, to identify behavioral and environmental changes to reduce risk of falls and injuries at home. Third, to share home injury prevention resources, tools, and tips. And fourth, to understand how to access the San Francisco Department of Public Health's Community and Home Injury Prevention Program Services, CHIPS. And with that, I hand the floor over to Rita. Rita, thank you for being with us, and the floor is yours.
Thank you, Michael Pappas. Thank you for the introduction. And also thank you, Ali Chu, for connecting me to Interfaith Councils as well. I'm going to share my screen. Okay. Okay, good morning, everyone. My name is Rita Huang, and I go by Rita. I am a health worker from San Francisco Department of Public Health, the Community and Home Injury Prevention Program for seniors. And you can call it the CHIPS program. The CHIPS program aims at preventing falls and injuries so people can age in place and live safely in their homes. According to the data that we gather from San Francisco Human Services Agency, we learned that San Franciscans aged 60 and older are the fastest growing age group and will continue to be. Many older adults live independently and alone, which we are learning that there can be a risk factor for negative health outcomes and fall risk, especially if they are also experiencing loneliness and isolation. Not only is the older adult population growing in size, but also in diversity of backgrounds and languages. Based on the data that collected by Department of Disabilities and Aging Services, our San Francisco community of older adults has shifted to become predominantly a population of immigrants. So you can see the data here that 52% of San Francisco's older adults speaks a primary language other than English. And our CHIPS staff provide services all across the city. And as a program, we are always working to meet community needs, and our small teams speak 5 languages in addition to English. So while there are many great things about aging, there are also increased risks that we should be aware of. The most likely injury leading to hospitalization or deaths for older adults is a fall. And the most likely place for older adults to fall is in their own home. And many people who fall, even if they are not injured, they become afraid of falling. So this fear may have caused a person to cut down on their everyday activities or other items as well. And when a person is less active, they become weaker, and this increases their chances of falling. And even non-serious injuries can significantly impact one's ability to get around, to do everyday activities, or even to live on their own. So here comes another statistics. So among our San Francisco population age 45 and up, falls are by far the most common unintentional injuries, resulting in emergency department visits and hospital admissions and deaths. So in 2015, there are almost 9,000 emergency department visits by San Franciscans age 45 and older as a result of a fall. In 2020, sadly, 65 San Franciscans over age of 45 died as a result of a fall. So falls and injuries are life-threatening and costly, but highly preventable. And we have all the power and resources to prevent falls and other home injuries. So we are here to help. So our CHIPS program is here to address prevention through education on falls and injury prevention. And we recommend behavioral and environmental changes to reduce risks of falls and injuries at home. And we also share home injury prevention resources, tools, and tips, including minor home modifications to increase safety for older adults and people with disability. So now, I would like you to complete a polling question about the home hazards that you and your loved one may have experienced at home. Trey, oh, thank you for helping me to fill up the polling. So here are the options: slippery floor rugs or mats, burns, falls or tripping, or oven or stove left on, shorted out electrical outlets, or maybe fire, or maybe carbon monoxide or smoke exposure, or maybe the hazards like clutter on stairs or walkways. Ooh, okay. Wow. Fall stripping, 62%, wow. Okay. We are going to close the polling question in 1 minute. So let's see what we got here. Okay. Wow, lots of people have fall or maybe have other incidents like slippery floors, rugs, fall stripping, clutter on the stairs, walkways. Okay, yeah, so look at the data here. So 53%, oh, okay, so 38 people answered this polling question, and 53% of our audience have experienced slippery floors, rugs, or mats. 32% people have experienced burns. Wow, 63% of audience have experienced falls or tripping, and 18% have experienced oven or stove left on. fire, 5% for prior fire, and 45% for clutter on stairs and walkway. Oh, so glad that 0% for carbon monoxide and smoke exposure. Okay, I'm going to stop sharing and close the polling question. Okay, and if you are still seeing the polling question window here, please close it. Thank you. Okay, so look like you or your loved one have experienced at least one of those unpleasant experiences before, but you are not alone. So seeing this picture in this slide, our CHIPS client have similar experience at home as well. That's why our program's here, because we are taking a two-pronged approach to help address both behavior changes and environmental changes to increase safety for older adults and people with disability. During home safety assessment, we are not just providing fall prevention education, but also remind people about the importance of behavior changes. For example, stay active to improve your strength and balance. Wear sturdy shoes, have vision check, have your medication check, or go to your doctor annually for the health screening, because everyone's health matters. We also remind people to get up slowly after you sit down or lie down. And also remember to walk slowly, and remember to use a cane or walker if you need support when standing or walking. So combining behavior changes and environmental changes together, we can identify and prevent falls through assessing, intervening, and using CHIPS services as a community and home intervention strategy. So when we do home safety assessments, our team provides education and services. We listen to the client's needs, and we also observe how the client moves around their home. So what they may hold on to steady themselves, etc. So here are a few quick tips for our clients. But I think everyone here today should pay attention to it for yourself and your loved ones in your home or their homes. When I do home safety assessments, I always start with the living room. So the most important thing is to prevent a fall. So make sure you don't have tripping hazards in your home. So for example, in the living room, don't use small area rugs. I have seen some of my clients use many of those small rugs in the hallway because they do not know where to buy a carpet. Or some clients, they place so many small rugs or towels on the top of their carpet so that they don't need to clean the carpet that often. So I understand the stories behind it, but I always recommend people to make a change, because I have heard hundreds of stories that my clients trip over on those small rugs or the mats or the towels that they put on the top of their carpet. Remember to keep electrical cords near the walls and away from walking paths. Arrange your furniture and other objects so that they are not in your walkway when you walk. This is very important, especially for people who use a walker or a rollator at home. And if you have kids or grandkids at home, make sure they clean up and organize their toys. It is their job to clean it up. And if you have stairs in your home, make sure to remove clutter that can be tripping hazards. So I have seen lots of clients put canned food, cleaning supplies, household supplies, and whatever you think that are not supposed to put on the stairs, they just right there on the staircase. And it makes it so difficult to pass the staircase as well. So I had one interesting encounter with my client. So I was doing the home safety assessment in my client's home, and she wanted to install a handrail for her interior stairs. So she was showing me where to install the handrail. And I noticed she has a cluttered staircase, and I suggested her to remove all of those items on the staircase. And she was like, oh, yeah, it was on my list, and I'm going to do it very soon. So right after she finished talking, one of the canned food fell on her foot, and she got hurt. And then she told me she's going to take care of it right away. Yes, we don't want to get hurt and make a change. What we should do is to prevent, right? So prevention is very important. So do it ahead of time. Don't wait. That's why installing handrails and lightening on the stairs is very important. And adding non-slip tape or materials to the stairways is also helpful too. Okay, so now we are heading to the bedroom, kitchen, and the bathroom. So in the bedroom, still remember to remove any tripping hazards, put night lights close to your bed, or move your bed close to the light switch so that it's easier for you to turn it on and off at night. Because a lot of times I heard from my client that they need to use the bathroom during midnight, and the nightlight helps them to see better at night. And always remember to keep portable heaters at least 3 feet away from everything. So I got this recommendation from our fire department webpage. So it's very important to keep in mind that this is kind of like a fire hazard. And some of my clients brought those electricity heating pad, and those pads can be turned off automatically at night. So you can think about this option if you really need one. And lastly, make sure your bed is at the right height for you to easily get on and off. So I have seen some of my clients use a stepping tool to get onto their bed because the mattress or the bed frame is too high for them. So then they have to think about to replace the items. And when you are in the kitchen, so remember to clean up the spills immediately. Never leave cooking unattended. Use a timer to remind you to turn off the burners or the oven, and turn the handle of the cooking pot towards the wall so that your body or your elbow won't touch it accidentally. I know it's not funny, but 95% of my clients have burned their pots at home, regardless of their age, gender, race, or ethnicity. So FYI, I have visited more than 100 homes last year. So remember to set a timer on your phone, or if you are not really tech savvy, you could even write yourself a little note. Says that boiling water, oven is on, and put it on the table right in front of you if you are watching TV, or put it anywhere that can catch your attention. Or another option is that to invite the CHIPS staff over so that we can do the home safety assessment and we can provide a timer for you. Okay, so now we are going to the bathroom. The bathroom is my favorite part. It does not mean that I want to see people fall here, but this is the place where I provide lots of fall preventions because lots of falls are happening here. Lots of my clients have fallen into their bathtub or shower stall, and one of my clients even broke his glass door when he fell inside of the tub. I'm so glad that he was safe, but it was a very scary incident for him. And he had us to install multiple grab bars inside and outside of the bathtub. He told me he never thought of installing a grab bar in the bathroom because he did not think that he needed one. He told me he was young and he doesn't need one. But after he fell, he called us right away, and he had us to install all these grab bars right away. And recently he gave me a call and told me that the grab bars have been really helpful to him and his wife because the grab bars is not just for him, but also benefits other family members. And he just told me, he said he should have called me earlier. Just like I said, don't wait. Don't wait until you get her and call us. Okay. So we also offer safety items to people based on their needs during the home safety assessment. So we bring the items to these items to clients' home and instruct them on how to use these items. For example, a suction shower mat to provide a anti-slip surface for people to step on during bath or shower. Night light with the sensory helps to reduce the nightly fear of falling. So the night light will light up automatically when it is too dark. And grab bar tool allows people to pick items up on the floor without bending down. And shoe horn too, it aims in putting on and taking off shoes without having people bend down too much and strain their back. So we also offer shower chairs and benches when a dual medical equipment approval is not available from a healthcare provider. And lastly, the kitchen timer, just like I mentioned in the previous slide, it's really helpful. So if you think you need this item, just give us a call. If more safety home modifications are needed, we coordinate with certified installers to add grab bars in the bathroom or next to the toilet, and also install handrails on all interior staircases, etc. For some installations, such as drilling into tile and walls so that we can install the grab bar and rails, a landlord authorization form is needed to be signed by the landlord before our installer team perform their work. But this rule only applies to the tenants, not the homeowners. So, and we are not able to provide more extensive items such as ramps or chair lifts, but we have resources we can provide. And each house is unique. So if there are certain types of tiles or walls that our installer cannot drill into, we can also provide you some resources if you need it, like those private contractor information. And during home safety assessment, we often observe and hear of other important health and social needs from our clients. So we partner with Department of Disability and Aging Services, Institute on Aging and Adult Protective Services, and more to ensure people are linked to necessary support services. Remember that our small team speak 5 different languages. So everybody speak English, and also one of the staff speaks Spanish, Russian, and I speak Cantonese, Mandarin, and Toisanese. So yeah, if you or your loved one or your friends needs the service, don't hesitate to reach out to us. Okay, so here comes the program eligibility requirement. So applicants have to be San Francisco residents. They can be renters or homeowners, 60 years old or older, or have disability. And if they need home safety modifications like installing grab bars or handrails, then they will need to meet the income guideline below. And so we have a pretty high income threshold for the home modification, and we can make referrals to private contractors for those who do not meet the income guideline, the income eligibility. And all CHIPS services are delivered to older adults and people with disability who are living alone or with others in non-institutional settings, including houses, apartments, low income, and senior housing. But I want to remind everyone that are a small program with limited staffs, and currently the turnaround time for the home modification is around 3 to 4 months. And our installers are catching up the works, but I would like to set up the expectation for everyone here. Okay, so there are many ways to sign up for the CHIPS program, and you can call or email us to sign up. If you prefer to fill out the referral form by yourself, you are welcome to go to our website and download the fillable referral form, or you can simply scan the QR code on the right side of the slide. Just use your phone, open the camera, scan the QR code, and then the website will pop up. The form will pop up, and you can fill out the referral form and submit it to us via fax or email. Or if you don't want to fill out anything, just give us a call. So here is the referral process. First thing, submit the referral form either via phone, fax, or email. And then our CHIPS staff will schedule a home safety assessment with you. And then the CHIPS staff will go to your house or your loved one's house to conduct a home safety assessment. So if you or your loved one needs home modifications, then we will arrange and coordinate with our installer to get the modification done. And lastly, I would like to give you some resources that is outside of San Francisco, because lots of times my clients refer our program to the family members or friends living outside of San Francisco. So I want to remind you that the CHIPS program is only serving San Francisco residents. And if the client or someone you know lives outside of San Francisco and wants something similar in the city, you may refer them to the information on this slide. So like Daly City, they also have something similar called the Senior Minor Home Repair Grant. And if you know someone living in the East Bay, they can call Rebuilding Together a Safe at Home program for more information. Okay, so here's my presentation today. And so thank you so much everyone for joining. Feel free to ask me questions if you have any.
Thank you, Rita. This was a very, very comprehensive. And I just wanted to remind our attendees that we will be sending out the recording link as well as some resource links, as well as your slide presentation. It was chock full of all kinds of important information. I'd also like to welcome Christy Dittrich, who is your supervisor, who is here with us too. And Christy, this is not a shy group, and over the past several weeks, folks have had questions that they've wanted to ask, and we would encourage our attendees, because this is an interactive program. We would like to be able to ask you some questions right now. And Christy, if we missed anything and you have some questions for Rita, please don't hesitate to ask as well. We do have a couple of questions, and I have a couple of questions. So I'm going to go back and see if we can start. From Anthony Chen, hi CHIPS, do you have any urgency installment program that my clients do not need to wait for 3 months?
Yes, hi Anthony. Yes, so we are also partnered with Home Safety Services Agency. Yes, agency. So each home safety assessment is unique. So our chief staff will do the assessment, and if this client needs urgent services, then we will refer our client to a home safety services agency. So their contractor can go to the client's house and do the modification within a week or two. So each case is different. So we have to do the assessment first.
Thank you. From Ali Chu, who is one of the organizers of this series, she asks, what is the time? There are a few questions in here. What is the timeline for the application process? Say someone hurts themselves while changing. Hold on. Because just moved up. They hurt themselves while changing a light bulb, for example, either not wanting to ask for help and having no one there to help. What may be, hold on, your recommendation to those and the service providers? So she asks, what is the timeline for the application process primarily?
So currently, my coworker is taking care of the Spanish, Russian, and English speaking client, and I am taking the Cantonese and Mandarin speaking clients. And yeah, we do have a wait list for the referral. So usually, we receive the referral form, and then we reach out to the client as early, like as soon as we can, and usually like within a week, we will return a call to the client to schedule the home assessment. And for home assessments, and currently my coworker and I are fully booked, so it might need to wait 3 to 4 weeks for us to conduct the home assessment. So after the home assessment, there will be another 3 to 4 months wait for the installations.
Okay, our dear friend Roma Guy asks, does CHIPS do assessments in single resident occupancy buildings where many older people live?
Yeah, we do home safety assessment at SROs as well, but a lot of times for SROs, or affordable housing or senior housing, the main thing we can do is provide the educational piece, but not the installation. Why? Because a lot of times this building have their own maintenance team, but our CHIP staff are happy to talk to the maintenance manager or the building manager if you need those modifications, so we can help you to talk to them, the management team, and get the request form. So yeah, we can assist on that.
Fang Huang asks a very important question, because I'm guessing a lot of our attendees are parts of faith communities or other groups and would like to train the trainers, if you will. Good question, thank you. Will Rita and your team offer on-site in-person workshops for larger groups of seniors? Yes.
So my coworker and I also go to senior housing or community center to do presentations. So because of our language capacity, so we can offer the workshops in Russian, Spanish, English, Cantonese, and Mandarin.
We also have here from Victor Gresser, can you explain the eligibility? Under 93,000 income for a single person, is that right?
Correct.
Okay.
Because we are not just helping the low income population, but also the middle class as well. Yeah.
Excellent. And again, we would encourage your questions. I have a few here, and I'm guessing that maybe Christy will as well. I think communication is a real important issue in terms of trying to avoid injuries at home. In the event where you have an older adult whose sole language is English, and they might be entering into the stages of dementia, and then the caregiver, English is a second language. Are there ways that loved ones can help make sure that communication between the two is flowing? So that I don't know if you understand the question, but I think sometimes communication can be a big obstacle, if you will, in avoiding injury.
I want to ask a question for clarification. So when you say caretaker, do you mean those caretakers from like in-home support services, or just a caretaker that the family member hire for?
Either. Which, I mean, I'm sure if you can address both. Thank you.
A lot of times, that's what I heard from my clients. So a lot of times, if they get a like in-home support services caretaker, and that organization will partner. Well, they will find the caretaker who speaks the client's language and assign that caretaker to them. So currently, I haven't heard anybody like having this language issue. So if there is, then I highly encourage the client talk to the IHSS caseworker to assign another person who can speak the language. And if the family member is finding a caretaker for their loved ones, just to make sure, yes, the caretaker also speak the loved one's language.
Okay, thank you. From Jose Murillo, do we need a confidential form for a third-party person?
Christy, could you take this question?
Yeah, it sounds like that would be to make a referral on behalf of somebody else. This relates to another issue where sometimes people
But if they're gonna
don't
send them out,
realize that
that's
they
fine.
need maybe a grab bar in the bathroom, or don't want to disturb their design of their home with these kind of, shower chair and thing. And we find that when family members are making the recommendation, it doesn't really land very well, but that if Rita comes out and is talking about it, or another person, that often that they're more open to it. So we do accept referrals from anyone, but the arrangement to go to someone's home really should be in agreement with that person. That's who Rita's going to be talking about, watching them, how they move around the room, and make recommendations.
We have from Katie Schwartz here, and Christy, stay on the line. I apologize for being late. So many have, so this maybe have been covered. How do we work with older adults who need some additional safety equipment, but refuse to accept it or refuse to use it because of pride or denial of aging?
Rita, do you want to share?
This is a challenging one, and we are still on the learning process with all these clients as well. So if this client is living alone, and if the client has a social worker or caseworker, then usually our staff will work with the caseworker and social worker and try to see what we can do to have the client to use the DME equipment. And if the client is living with their family members, so usually we will work with the family member on that. But of course, if this person is living alone and already has all these aging issues but not listening to anyone, then we highly recommend this person to talk to the doctor. So the doctor's advice is very important. Ask them to follow that. But the very bottom line, we have to respect the client's choice as well. If the client highly decline, like refuse to make any changes, we will do the assessment. If the client is in a critical condition, then we have to report it to Adult Protective Services for more help, like for self-neglecting. But if the client is alert and highly functionable and knows what he or she is doing, then we have to respect their choices.
Thank you. And I also want to say thank you to Larissa Medvedeva, who also offers language line could be used for assistance in translation. Would you be able to use it?
Yes, so I do have clients who speak Vietnamese, then we use language line for interpretation, and it turns out very well.
Can you explain what it is and how to access it? I mean, this is the first time hearing of it. Yeah.
Oh, okay. So so I have this Vietnamese speaking client lives in a senior housing, and yes, so I call into the language line, and then we provide them my caller ID, and then tell this interpreter that I need a Vietnamese interpreter for my client, and then the language line representative just connect me with a Vietnamese speaking interpreter. And then the interpreter helps me to call the client. And then, yeah, we started the conversation like this on the phone.
Is it a free service? Is it a service of the city? Yes, Christy.
Yeah, Language Line is a private company that the city contracts with, but there are other kinds of language lines, and maybe I can put them in the chat. Some that are free, done by nonprofits.
That would be great when we send out today, if we can get it to go out with the recording link. I think that would be an important service.
So,
Okay, thank you. Just to go back to the home safety assessment, who should be present when you're there? Number one, can you tell us about what that looks like when and I'm wondering only because for the past 3 years we've been living in isolation. Okay, I'm guessing that the number of people that have invited you into their home has gone down a little bit. I want to incentivize people to take advantage of this program. How would you incentivize people to take advantage of this program? Number one. Number two, who should be at the home, and from the time, and how do you get a home assessment, and what's the turnaround time? Can you just repeat that? I think you might have mentioned it earlier.
Oh yeah, so currently the turnaround time for home safety assessment is around 3 to 4 weeks, and for home modifications will be around 3 to 4 months. Yeah, so usually when we do the home safety assessments, either I will go by myself, or my staff will, or my coworker will go by herself to the client's house, and we would prefer the client to stay in the home if possible. So yeah, because we just want to see how they move around the house, then we can provide more suggestions. But things happens and we never know. So I have clients where they make the call and suddenly they admitted to the hospital. So, but they don't want to wait for another few months for the home safety assessment. So they have their family member to stay in the house and open the doors for us. So still, we walk through the whole apartment, the whole unit with the family member. And usually the family member can show us, oh, this is where my mom stays in the day, or this is how she goes to the bathroom. So they will tell us everything, and then we'll tell them what to do with the mom or the dad, something like this. So the family member will transfer all these messages back to the client themselves.
Okay. Victor G is asking, is a HIPAA release information required to include chips?
Christy, can you take this?
Yeah, we're not collecting any health information nor sharing any, so we don't require HIPAA form.
Okay. Hold on, I need to close this. We have a bunch of other questions too, which is great. Thank you for asking that. I have a question too, is if, say you go in and you see something that's not looking right, are you mandatory reporters to have to share information with, authorities?
Yes. Yeah. So I have been to some clients' homes, like you could tell from the very first side that they are self-neglecting, like the hygiene is really poor and clutters everywhere. So we have to report it to APS for self-neglecting. Yeah. Okay,
I think that's important to know. Again, from Kimberly, I think that we need to clarify this $93,000 income level. I noticed a person has to make at least $93,000. Is the sliding fee, is there a sliding fee scale? Can you talk about that $93,000? Because it seems to be a sticking point for the confusion.
Yeah, sorry, that chart just means that your maximum would be 93. So if you're under 93, then you're eligible for one person. For two people, I think it's 106,000.
Oh yeah.
We have just the eligibility criteria is adjusted for San Francisco, and we actually use DOS's eligibility. And just, you know, we're funded by the general fund in the city, so by taxpayers. But we don't get a whole lot of that money. So I'm always looking for additional funds, you know, to support, especially for the home modifications. So we did have to set some parameters for that.
Okay, we're getting some, Christy, we're getting some background noise, I think, I don't, in one of your, so just be conscious of that. From Ali Chu, what may be resources for those who have lots of things at home making unsafe and need support? Not maybe the hoarders she's speaking of, I don't know.
Yeah, we do have the resources for decluttering services, so we can provide the information to the client, and like especially the client wants to get rid of the clutters. And sometimes if the client has a social worker or caseworker, and usually the caseworker or the social worker will help to get rid of those items as well. Like they can donate it, or they can just have the decluttering services to go over and do the decluttering services.
That would, you know, if you could include that among the resources links we can send out today, I think that might be helpful to some of our attendees here. Christy, do you have any questions? Because we have this small gift of time. I'm sure there are some, excuse me, frequently asked questions that did not come up today. Is there anything you'd like to pose to Rita, or just share to complement and to supplement this presentation?
Yeah, thanks. Well, a few people mentioned, you know, the wait list and, you know, that it takes time. Unfortunately, many people are signing up for CHIPS after they've had a fall. So we recommend doing this ahead of time. Then the time, you know, waiting a month or two may not be so bad, but we also encourage people to, you know, learn from this presentation and make the behavior changes.
I've got to get ready. Okay, thanks.
Sorry.
Bye.
You know, themselves while they're waiting for the home assessment visit. And even having their son install a grab bar, we've had people do that. Family members, you know, are able to provide supplies, put on the non-skid tape, you know, while they're maybe waiting for that home safety assessment from Rita or more larger modifications.
Great. Thank you very much. I want to, this is a very, very important topic, probably one of the most important, you know, and in my own life, I've seen older adults who have fallen, even when the caregiver is there, but in another room. And so I think it's important that you have given us these resources and some insights, and we will be sending out the resource links today. In addition to thanking you, I want to thank Trey Russell Allen, who's been our consultant, tech consultant, as well as Cynthia Zambucas, who is our program and administrative associate. We also want to say, invite you all to join us next Thursday for the fourth in the series of trainings that's going to focus on isolation. Okay, this brings to a conclusion today's program. Look forward to and share the recording link and resources that you'll receive today. And we look forward to being together next week. God bless you and God keep you.